See, the inspiration comes from every source. When you are able to save a life, you don't save one life, you save the entire family. So the entire feeling of having that thing that you have done that purpose keeps you going the next day again. I am Dr. Shivanshu Goyal, and I'm a senior consultant pulmonologist. I'm into a branch which is concerned with pulmonology, intervention pulmonology, and sleep medicine. I spent good 2 years at Safdarjung Hospital, where I did my internship, and that is where the respiratory medicine was almost certain. At that point, I took this branch very seriously, went for my post-graduation, then later on we come to practice. If you have a good sleep, it energizes you, it vitalizes you both physically, mentally, emotionally. Your immune system significantly depends on how good sleep you have. If you have not spent a good time sleeping, you're not going to have a productivity, and that sleep lag accumulates. So sleep hygiene measures are very, very important. Sleep hygiene means try to avoid sleeping during the day. Don't take caffeine or any caffeinated products in the second half of the day. Avoid blue light exposure at least an hour or 1.5 hours before you go to the bed. Restrict your bed only for your sleeping and your bedroom activity. I usually get up around 6:30. That time we are getting our daughter ready to reach to a bus stop. 7:15, me and my wife, we go for a walk. We come back, we have a breakfast. 9:15, I leave from my house to go to my hospital. From my hospital, we have got a list of patients. I meet my team. So we plan our day in such a way that where we are going to do our rounds, procedures, and then I'm in my outpatient department. After this, I again take my evening rounds before I go back home. Rather than directly coming home, I go to my club, where I have made a point that I do one physical activity in the evening before I come back home. I'm usually done with my dinner by 8 o'clock. From 8 onwards is a time for my family. Then me and my wife, we spend some time again together, and along with my daughter or somebody visiting us, we have a billiard room, we play billiard, my wife sings or she plays guitar. It's a me time. So after 11, we are off to the bed and good 7.5 hours of sleep. Diksha met me when I was doing my post-graduation.
I think doctors should marry each other. So I have no double thoughts on that. He's always appreciative of my work, and the amount of trust we have on each other, it's remarkable. So we really appreciate being in that relationship and harboring it now from 10 years.
Prioritization of tasks, I learn a lot from both of them. Like whenever I'm in any sort of, conundrum on how to prioritize my work, I often ask Jeju, like, this is what I'm struggling with, and he'd guide me, to make the right decision or look at the broader picture.
For every son, I think the father is a role model, but specifically for me, we used to see patients coming home, coming to our clinic and telling that, we are blessed to have your father as our treating doctor. Padma Shri was obviously a feeling which all of us cherish in our family. We were so proud of our father always. It has been a huge feeling for me as a son to see my father do all that, and if I'll be able to ever fill that shoe ever in my life, I don't know.
The day he wanted to become a doctor, and I said, that's the best profession, and there's no profession better than this in this world. Go ahead, and there it is.
Every day you get new cases, and every day is a challenge for you as a doctor. A lady who was with us in COVID was a challenging time for every doctor, and specifically for us pulmonologists, we were on the front. This lady was very sick, very critical. Her son came to me once. They were like, sir, we are looking up to you, and I want my mother back. So that line was always in my mind. We put her on a advanced machine, and eventually we got her out of this. 4 months in the ICU, and today she comes to us as a healthy lady. She writes papers, she's a mathematician. That feeling is unmatchable. Having a feeling that you are the chosen one to do this job. The God has given you that message that this calamity is there, mankind has to face it, and being a pulmonologist, you are the one to deal with it.